think we should get started. So welcome everybody at this Lunch and Learn of January 22nd with the title Advancing Health Equity, where we have a deeper dive into early support for families and active living for underserved groups with Janine and Cem from Wageningen and from the Eindhoven University. My name is Martine van der Mast. I'm Program Director of the Institute for Preventive Health, and I will be your host for today. I first will talk a little bit about the Institute for Preventive Health, which is a collaborative initiative for between the universities of Eindhoven, Wageningen, Utrecht University, and the University Medical Center in Utrecht. We have a goal or a mission that we strive for research and education to support the mission at least 5 years longer in good health and decrease the health differences between socioeconomic groups by 30%. We focus on 4 themes: healthy start, preserving health, living with disease, and health at home. And we have 2 cross-cutting themes: participatory research and transition thinking. We aim to do that with 3 focus activities, namely research, education, and community building. But now let's dive deeper into the presentations, and I would like to ask Janine to start sharing your presentation.
Do you now see my presentation?
Yes,
Okay. So, hello, my name is Janine Faessen, and I'm a postdoctoral researcher at Wageningen University at the Department of Human Nutrition and Health, focusing on early life nutrition. And today I will be talking about dietary support in the first 1,000 days and the current intervention we have been developing, and also looking forward to the next steps of our project. So the first 1,000 days are the months the first months start at the first month before conception up until 2 years of age of the young child. And this period is in the literature often also called a window of opportunity, as this period reflects life-changing events in which priority shifts and new lifestyle habits can be formed. And therefore it can be valuable to focus interventions on this window of opportunity. So the past years we have been working on the PRESTA project. In this project we developed the dietary support tool for pregnant and postpartum women, which is called the PRESTA app. In the development we took a person-centered approach in which we wanted to acquire much input from the end user, and in order to develop a tool that would eventually also actually really be used by the target user. So to achieve this, we acquired knowledge on the current dietary support provided to these women, and also the experiences and needs they have during these periods regarding nutrition. So to look at a few studies that we have performed. One study was on a review of pregnancy apps, in which we included 57 apps that were available in the Dutch app stores, which incorporated some level of nutrition in their app. And we saw that most apps simply provided information to women without any interactive features. And this is linked to a low engagement of women with the app. So also apps ask very little about the women's situation, resulting in the information being quite one size fits all. Then to understand experiences and needs of women regarding nutrition, we performed a survey study among about 1,600 women, and we split the answers in trimesters and in 10 weeks postpartum, and we saw quite some differences over time. So I wanted to highlight a few here. So for example, the general experience that they reported on a range from 0 to 10 was quite low in the first trimester compared to the other periods. And we also saw that the subjective diet quality score was also, particularly in the first trimester, quite low. But women still did indicate that the importance of a healthy diet was actually highest in the first trimester. And that also corresponds to the desire to learn more, which was again highest in the first trimester. And we also saw that it was quite high the first 10 weeks postpartum. So that's actually in the first weeks of a new phase. And well, what I wanted to show here is that this would indicate that motivation deviates between these phases, as well as the ability to actually eat healthy. And this could all indicate that it is relevant to intervene or adopt an intervention based on the phase women are in. Then additionally, we also performed 30 interviews with pregnant and postpartum women. And one prominent result was that women indicated that they struggled to transfer general advice to their personal situation. So, for example, one woman said, nutritional advice, yes, what kind of mattress is good to buy for your baby? That's easy to find. But how to keep everything like nutrition balanced, and what you actually get from your food, what you can still add, that's such a maze. And another woman mentioned, I thought it was actually much more complicated to figure all that health and nutrition out. Changing my eating patterns seemed difficult, so I thought a supplement would be easier than trying to add a lot of calcium through my diet. And this would indicate that it is relevant to provide more personal support that is adapted to the individual situation of women, but general advice being quite difficult to apply. Then, well, these are a few results, a few studies mentioned, but we also did other studies. And together, these studies were the input for the development of the Prista app. In the previous project, we were able to develop this first version of the app. And well, I would say the most important feature of the app is that it adapts the advice to the personal profile women can set, as well as to the answers that they give to a short dietary screener. Then the next step is to go from only the women to the whole household, including also child nutrition and partner involvement. Well, we also heard from many women that they have a strong focus on their child during, well, pregnancy and postpartum. We think that combining the women with the child and the partner in one intervention, that can also motivate women to work a bit more on their own diet. And we also think it can be provide more sustainable dietary changes. We also saw that partner involvement was quite low in past studies. Maybe also, of course, because we focus particularly on the woman. And we think it could be improved as well. Then another important focus of our next step is that past research has included almost only highly educated women who already had a strong interest in nutrition, but these are not the women where most progress can still be made. Therefore, in the next phase, we will focus on inclusive research, particularly targeting households with low socioeconomic positions. And to target these, we aim to use different recruitment strategies. While in the past, we recruited mainly via flyers and posters at midwifery practices or, for example, childcare centers. And we also recruited much via social media channels. We now, in the next project, want to recruit more in person, face-to-face, also with the help of actors who are already in contact with the target group. And this way, we hope to recruit a more diverse sample of participants. And also something related is that while women in previous studies were quite positive about using an app for dietary support, it is unclear whether an app would also fit for households with low socioeconomic positions. The women in our studies also indicated that for using an app, they already needed some kind of motivation to start using it. It's quite an individual method, of course. So potentially other intervention methods may be better suitable. or a combination of the app with, for example, a center and care group practice, it might be an option, but that's still something that we need to study. But it is therefore important to remain open to other options as well, besides solely using an app. Then for the upcoming studies, as it is a seed project from the EWUU, we were able to work with a multidisciplinary team on the further steps of this project. And besides partners from the Alliance, we also work together with the advisory agency Groente en Meer, who is specialized in diet and behavior of the child, and also assist parents in helping their child eat well. And we're working with Balanced Body, which is a nonprofit organization that connects buddies who are often student volunteers to families with low socioeconomic positions in order to help with lifestyle activities, for example, diet related. So the next step, we also want to gain more understanding of partner involvement in child nutrition support in early life. And we will do that by performing interviews with caregivers and professionals. And then the caregivers are recruited via the Balanced Body organization. And eventually we want to do co-creation sessions to sit together with caregivers and professionals and work on an intervention design, looking also beyond solely the app. And eventually we hope to be able to develop an intervention that is flexible and can be adapted to suit the needs of a diverse range of households living in the Netherlands. So yeah, that's in short what we have been doing and what we still aim to do. Thank you for your attention.
Thank you, Janine, for this very interesting talk and very well done. I was wondering if there are any questions for Janine. We've got a couple of questions, time for questions, a couple of minutes. Maud, I see a hand raised.
Yeah, good day. My name is Maud Verhoef. I'm calling in from the University of Utrecht. I joined a few slides in, so maybe my question was already answered in the beginning. Thank you very much for the presentation. I noticed in the end, of course, that you tried, okay, the next step is to focus on the lower socioeconomic position. But I also quickly read what the advices were given in the app, talking about peulvruchten and also fish. How sometimes it's not knowledge what's limiting the amount or the healthy foods that a family can provide, but it could also be financial. So by telling them that they should actually do it differently, but they can't afford that, how do you take the financial part into account? Having the maybe misconception that healthier food or fish is also a more expensive option.
Yeah, that's a very good question. I think we also asked women indeed their perspective on whether healthy food is more expensive, and in general that was also a little bit the perspective that they had. How we want to tackle that, I think indeed for now in the app that's not covered, but I think it's something that we also want to talk with the households, with the father and mother about.
It might be something that is addressed not as easily because people don't like to mention that as a reason. They say, well, we always eat meat, or we don't do fish, or I don't like it. But it might be that this can be well, I'm an epidemiologist, so when we did research, we always, of course, took also into account, and it might be that this can be of effect.
Yeah, I think it's always good to, in the advice, put some attention on the financial part as well. Definitely keeping in mind their assumptions regarding indeed healthy food being more expensive.
Yeah, maybe also good to mention that at the Institute for Preventive Health, we also have an advisory board of people with lived experience. And Janine will have access to that to ask these people about their experiences and the limitations as well, and what is needed. So, Yeah, Monique, you also
Yes.
raised your hand.
Yes, thank you very much. Interesting talk. I'm just wondering, as an old lady, whether or not we should to raise the inclusion of the people we like to include, to pay them. I mean, it's an American idea, and I'm not pro-American at the moment, but we always say that is impossible, but it is one way or the other. To get them included the way we do now is extremely expensive. And paying the people because they need it is another way of thinking and might raise the inclusion immensely. I know it's an idea that has some ethical problems, but on the other side, why not changing the way of including this group especially? Just your question to you, colleague.
Yeah, no, I think that's a very good point. At least that's also what we definitely have been struggling with, thinking of, okay, how can we still recruit these more diverse people, because now it's just highly educated, interested people in nutrition, and then indeed, money can be a good incentive to participate. So yeah, I would say it's difficult ethically, but still interesting to consider. Or at least be creative in the options you can think of. Because the traditional methods just don't really work well.
It's a very valid question, Monique. Our or people with lived experience participatory board, I don't know the exact name. These people, this group, they have very different backgrounds. They all have lived experience in all kinds of ways, and they are indeed being paid. So they are part of the group, and So Janine has access, like I said. So
yeah.
Should there be more questions for Janine? There might be time at the end because we really would like to stop 1 o'clock sharp. And I want to give our next presenter time as well and the floor. So go ahead.
Yes, thank you very much. Let me share my screen. Oops. Yeah, I hope you can see my screen. Yes, hello everyone. My name is Cem Ataman. I'm an assistant professor at Eindhoven University of Technology in the Department of the Built Environment. And in this presentation, I will briefly talk about the EQUAL project, which stands for Enhancing Equity for Active Living Through Digital Tools. Oops, yes. So we started the project last year in January, and then it just finished right before the summer break. So it was under the call Embracing a Transdisciplinary Approach to Drive Preventive Health Transformations. So Gamze was our lead, and at that time I was working as a postdoc in this project. And then we had quite an interdisciplinary team. We had Shehnaz and Çağdaş as our SME partners, and we had Bige, Ayla, Haneke, and Labib as our partners from the EWUU Alliance. So how we started EQUAL? So we realized that active living inequities emerge from limited interactions between marginalized groups, their physical and social environments, and their access to digital technologies. So when I say marginalized groups, I am referring to disadvantaged, underrepresented groups. So with this urgency, we aimed to generate knowledge and practical insights on how digital tools can support the meaningful participation of such groups in urban decision-making related to active living. And then we wanted to provide an inter and transdisciplinary approach that integrates equity, active living, and digital technologies to address participation gaps in cities. So we started with this responsive city framework. So with this framework, actually, the idea is to collect data from citizens via a participation tool, then translate that data to conduct data analysis, and then end up with informed urban designs and programs. But with EQUAL, we specifically wanted to focus on marginalized groups, and then we looked at how we can tailor data collection with AI, VR, AI-enhanced technologies. And then we specifically looked at active living interventions, and we wanted to provide a more stakeholder-centric decision-making process. And then we specifically focused on the design of this urban decision-making interface, specifically for marginalized groups. So now I will talk about some concepts. So we wanted to come up with a very concrete list of requirements that we can use the design of a digital tool when we want to integrate marginalized groups into decision-making processes. So for that, we started with meta needs, which are quite high-level abstract needs. And then step by step, we translated those meta needs to first design needs, then design principles, and then finally very concrete functional requirements. So let me go through the process that we had. So we started with an extensive literature research. And then we checked practical, personal, motivational, and socioeconomic barriers of those groups to be involved. And then we examined those barriers in 3 pillars, which are human and social, political, and technological. And then we came up with our meta needs. Then we conducted some semi-structured interviews. And then we discussed specific topic that I will be explaining in a minute. And then these informed our design needs. And of course, they were always somehow feeding each other. And then we had a 2-day workshop at the end of the project to validate our result and get feedback from experts. And then, of course, this turned back to our meta and design needs. And then at the end, we came up with our functional requirements. So we interviewed 11 experts, in academia from different backgrounds, but also from municipalities, as policymakers, advisors, project coordinators, etc. And with them, we specifically discussed municipality and neighborhood collaboration, functional scope and feature definition, stakeholder understanding, information access, and clarity and communication gaps, specifically in the involvement of marginalized groups in decision-making processes. Then we had our workshop in Eindhoven. So in the workshop, we had a very diverse background of experts. So we had architects, urban designers, planners, but we also had sociologists, software developers, health professionals, representatives from municipalities, and even representatives of commercial companies who are designing digital tools. And then we worked on a case study, a real-world case study given by a municipality, where they wanted to design a so-called bump tract to enhance physical activity, play, and social interaction for people of all ages. And with that case study, we started discussing our meta needs. So this is just a summary of our list. So what we wanted to do to understand how we can somehow bridge the barriers and meta needs to provide solutions. And then with those meta needs, we came up with our design needs. So these design needs are still quite high level, but we again map them into our teams. And these needs like engage community ambassadors, or ensure data security and privacy, the needs that we should be embedding into our digital tools. And we had a master's students on board, and then she finally translated those needs into principles, and then we came up with 34 functional requirements, and which in which we categorized into 6 principles, which are inclusive outreach, empowering engagement, participatory co-design, clarity and simplicity, trustworthy transparency, and adaptive accessibility and feature definition. And then what we want at the end, actually, we realize that it's not that simple to create a digital participation tool for the marginalized groups to start using immediately. First, we need to build trust in the pre-participation phase, even before participation. Then, of course, during participation, we should enhance the participation experience. But what is important is that after participation, with the insights that we learned, we should also co-design participation tools with their users. So we said that it's never about the process or tools or culture separately, but we should combine them, and we should consider participation process, participation tools, and participation culture together, because we see citizen participation as a socio-technical paradigm. And then unfortunately, we cannot really provide a solution in 1 year, 2 years, but it's a really long-term process if you want to integrate those groups into decision-making processes for healthier lifestyles. And with that, actually, we concluded that these design frameworks, specifically for digital participation tools, can help move from data to action, or in other words, from ad hoc engagement to a more systematic participation process or system. And we definitely saw that equity must be made operational. It shouldn't just be assumed. And in that sense, centering marginalized groups in spatial decision-making is essential because they need more tailored participation tools. Because in common processes and common tools, actually, they are not willing to be involved in those processes. And lastly, digital participation can really connect behavior to spatial design. But for that, we need to build a participation culture, not just the tool themselves. So we will have 2 main research outputs, 2 journal papers. Unfortunately, they are not publicly available yet. It's still in progress. But the first one is designing active cities for all, digital participation tools for active living environments in marginalized communities. This is mostly a position paper where we will combine all the expert backgrounds that we had on board, especially during the workshop. And the second one is about inclusive participation system, where we are talking about the design knowledge base which we created for the design of an AI-enhanced digital citizen participation tool. And this brings me to the end of my presentation. Thank you very much for listening.
Thank you for this very interesting talk. Again, some insights on how to involve specific groups into research. And I was wondering if there are any questions from the audience. I see one in the chat. Does the participation have to be digital?
So digital participation has some advantages and disadvantages. So the disadvantage is that, of course, we are talking about digital literacy, and then those groups can have difficulties in accessing those mediums, or they might not feel comfortable in using such tools. But it has a huge advantage. First, actually, two huge advantages, I would put it. First, it creates a certain anonymity. And that anonymity is very important for those underrepresented, marginalized groups. So actually, they can speak more freely, I would say. And the second advantage is that actually it provides an opportunity to enlarge the scale. If we talk about digital participation, we can really increase the numbers of participants, which might not be that possible if it is a more traditional face-to-face interaction. So if we are really aiming for thousands of people, then digital tools are really the best way to include. But with that, I think we should always consider that it should be a combination of digital and physical participation to have the most meaningful data in the end.
Thank you. Tina, does that answer your question? Yes, in the chat. Nice. Are there any more questions from anybody else? There are more people in the call, so well, then everything must have been super clear. So I think I would like to thank Janine and Cem for their presentations. And I would like to invite you for our next Lunch and Learn, which is next month. And I am not entirely sure anymore what the topic is going to be, but you will receive an invite anyways. So thank you again, and see you next time.
Thank you very much. It was nice to see you all. I hope to see you next time.